Itching is something we all experience from time to time, especially as we age. Sometimes it's just a minor annoyance, like a bug bite or dry skin. But if you've ever noticed a persistent itch, especially in certain areas of your body, it's worth taking a moment to think about what's going on beneath the surface. After all, as we age, our skin and our bodies can change in ways that might signal something more serious. Have you ever scratched an itchy spot on your body and thought, it's probably nothing? Or maybe you felt embarrassed about mentioning it to a doctor because you figure it's just part of getting older. Well, let me tell you, there are certain itchy spots that shouldn't be ignored, especially if you're over 60. They could be signs of something more serious. Conditions that require your attention and care. Now, I know that some of you might be thinking, it's just a little itch. I'll be fine. And I get it. As we get older, we deal with a lot of little things. Aches, pains, and minor health issues. That often seem to come with the territory. But there's a difference between something that's truly minor and something that could be a red flag. So in today's video, I want to talk about 5 itchy spots that you should never ignore once you hit that 60 mark. Let's dive in. The first itchy spot I want to talk about is the scalp. Have you ever had that uncomfortable itch right on the top of your head or along the back of your neck? It's one of those things that's easy to brush off, but it could be a sign of something you don't want to ignore. While a dry scalp or dandruff can certainly cause some itching, it's important to remember that scalp issues after 60 can sometimes be more complex. For instance, seborrheic dermatitis is a common condition that can cause itching and flaking, and it's not just a sign of a dry scalp. It can lead to redness, scaly patches, and even hair loss in some cases. It's more common in older adults and can even be triggered by other health conditions like Parkinson's disease or heart disease. If you've been noticing an itch on your scalp that won't go away, or if you see flakes that aren't just from shampoo buildup, it might be worth talking to your doctor. They can help rule out any underlying conditions, and if it's seborrheic dermatitis, there are treatments that can help keep it under control. But it's not just about the scalp. Let's talk about the neck, particularly the area around your collarbone. It's a spot we don't often think about when it comes to itching, but when that area starts to itch frequently, it can sometimes indicate something more serious, like a skin infection, or even a sign of something like a thyroid problem. As we age, thyroid issues could become more common, and symptoms like itchy skin, fatigue, or even weight changes could point to a thyroid imbalance. If the itching around your neck is persistent and you've also noticed other symptoms like swelling or fatigue, don't brush it off as just aging. A quick checkup can make a big difference. Another spot you might not immediately think of when it comes to itching is your back. It's easy to miss changes in the skin there, but if you notice a persistent itch on your back, especially in a specific area, it could be a sign of a skin condition that needs attention. One thing that can cause this kind of itch is a rash that's related to shingles, which is more common in seniors. Shingles can begin as a tingling or itching sensation, and it's often followed by a painful rash that typically appears on one side of your body. While shingles usually resolves itself, it can cause long-term pain if left untreated. If you're dealing with an itch on your back and you also notice any rash-like symptoms or pain, it's best to get it checked out right away. And then there's the issue of the legs. If you've ever scratched your legs until they're red and irritated, you know just how frustrating and uncomfortable it can be. But persistent itching, especially on the lower legs, can sometimes point to a circulation issue. Poor circulation is a common concern for older adults, and when the blood flow to your lower limbs isn't as strong as it should be, it can result in dryness, itchiness, and even swelling. If you've been noticing more frequent or severe itching in your legs, it might be time to take a look at your circulation. It could be a sign that you need more movement compression stockings or even medical treatment to keep things in check. The last spot I want to touch on is the stomach area. Now, this one is a little more common than you might think. You might start noticing an itchy spot around your stomach, and at first, it doesn't seem like a big deal. However, if that itch is accompanied by pain, bloating, or changes in your digestion, it could be a sign of a more serious condition like an allergic reaction, digestive issues, or even a liver condition. The liver plays a critical role in filtering toxins from the body, and when it's not functioning properly, it can cause itching all over your body, but especially around the abdomen. It's easy to think that this is just a minor irritation, but it's important to listen to your body and speak with your doctor if it doesn't go away. These itchy spots may seem like small, insignificant problems at first, but they could be signs that something more serious is brewing under the surface. I'm not trying to scare you. I'm just encouraging you to listen to your body and seek help when something doesn't feel right. Trust me, a little attention now can make a huge difference in your health in the long run. So if you've been dealing with persistent itching or skin changes, don't ignore them. Now that we've covered some of the more common itchy spots, we're just getting started. In the next part, we'll take a deeper look into some other areas you might not think to check and why they can be important. Stay tuned. Now that we've covered some of the more common itchy spots, let's move on to a few areas of the body that may not immediately come to mind when you think about skin irritation, but could actually be signs of something more serious. Let's start with your arms, particularly the upper arms. As we age, our skin loses some of its elasticity and moisture, so it's normal to notice a bit more dryness or irritation. But when that itchiness turns into a persistent or recurring problem, especially if it's accompanied by red patches or bumps, it's important to pay attention. One condition that could cause this is a type of eczema called atopic dermatitis, which is more common in older adults than most people realize. It can cause extremely dry, itchy patches of skin, often on the arms, but can appear anywhere on the body. If you've been dealing with irritated skin on your arms that doesn't seem to improve with lotions or moisturizers, it might be worth asking your doctor about it. Sometimes eczema can be triggered by allergens or other environmental factors, and with the right treatment, it can be managed effectively. But there's also another possible cause for itching in the arms that's a little more serious: liver disease. When the liver isn't functioning properly, one of the symptoms can be generalized itching, especially on the arms, legs, and torso. If you've been experiencing itching along with other signs like yellowing of the skin or eyes, unexplained fatigue, or changes in your appetite, it's important to have your liver function checked. Don't write it off as just aging or a skin issue. Your liver health is crucial, and getting checked could save you a lot of trouble in the long run. Next, let's talk about your feet. It's easy to overlook your feet, especially if you're not experiencing any obvious pain or swelling. But itchy feet can sometimes indicate a fungal infection, such as athlete's foot. Fungal infections are more common in older adults, and they're especially common in places like public showers or swimming pools. Athlete's foot causes intense itching and irritation between the toes, and it can spread to the bottom of your feet and even your nails if not treated. If you've noticed that your feet itch constantly, or if you're seeing flaky skin or redness in between your toes, you might want to consider using an antifungal treatment. And if the symptoms don't go away, see a healthcare provider who can help diagnose the issue properly. On the other hand, persistent itching in your feet can also be a sign of nerve problems, particularly peripheral neuropathy. This condition often causes tingling, numbness, and itching in the feet and legs, and it's more common among those with diabetes. If you've been managing diabetes, or if you've noticed other symptoms like weakness, balance issues, or an unusual feeling in your feet, it's worth getting your nerve function checked. Peripheral neuropathy can be controlled, but the sooner you catch it, the better. Now, let's talk about an area that a lot of people might forget about until it starts causing a problem: the palms of your hands. If you've ever experienced itchy hands, you might have just chalked it up to dry skin, but if the itchiness doesn't go away, or if you notice redness, blisters, or peeling skin, it could indicate something more serious. One possible cause is a condition called contact dermatitis, which occurs when your skin comes into contact with an irritant or allergen. If you recently started using new soap, lotion, or even laundry detergent, it might be triggering an allergic reaction on your hands. But itchy palms could also be a sign of something more serious, like liver disease. As I mentioned earlier, a poorly functioning liver can lead to widespread itching, especially on the palms, and it's something you don't want to ignore. It's also important to pay attention to any unusual itching that comes with swelling or changes in skin color. If your hands or fingers are swollen and the itching seems to be more than just surface-level irritation, it could indicate a systemic issue that needs to be addressed. Again, this could be related to circulation problems, autoimmune diseases, or, in rare cases, a sign of an underlying cancer. These conditions may not be the first thing that comes to mind when you think about itchy palms, but your body is trying to tell you something, and it's worth taking time to get a proper evaluation. Now, Let's take a look at a spot that might be a little harder to check on your own. Your back. I know it can be difficult to reach certain areas, especially as we get older, but persistent itching on your back should never be ignored. The most common cause of itching on the back is dry skin, but it's also an area where conditions like shingles could develop. You may have heard of shingles before, but did you know that the initial signs can often be an itchy sensation or a burning feeling in one spot on your back? It usually starts with tingling or itching before the painful rash appears, and it can be very uncomfortable if left untreated. If you've been experiencing that burning or itching sensation on your back, particularly if it's only on one side of your body, it's time to speak to your healthcare provider. Early treatment can help reduce the severity of the outbreak and prevent long-term complications. But it's not always shingles. Itching on the back can also be a sign of other underlying health problems, like kidney disease. While it may sound surprising, kidney disease can cause your skin to itch all over your body, especially in the back. This is because as the kidneys stop functioning properly, toxins can build up in the blood, leading to itching. If you've noticed other symptoms like changes in urination, fatigue, or swelling, it's important to check your kidney function. It's one of those things that's easy to overlook, but the earlier you catch any potential issues, the easier they'll be to manage. The truth is, itchy skin may seem like a minor nuisance, but it can sometimes be a warning sign that something more serious is going on inside your body. If you've been experiencing any of these persistent or unusual itchy spots, it's time to take notice. Don't let these warning signs go unchecked. Taking action now can help you maintain your health and live your best life without worrying about potential complications down the road. Now that we've covered some of the common itchy spots that should never be ignored, it's time to wrap things up. Stay tuned for our final thoughts. And remember, paying attention to the small details can make a big difference in your health. As we wrap up this discussion on itchy spots and what they might mean for your health, let's take a moment to reflect on the importance of staying proactive when it comes to your body. Itchy skin can sometimes seem like an insignificant issue, especially when it happens in isolated spots or goes away after a few days. But as we've seen, certain types of itching, especially those that linger or are accompanied by other symptoms, should not be brushed off. It's always better to be safe than sorry, and addressing these concerns early can prevent more serious issues down the road. By now, I hope you have a better understanding of the areas to watch out for and the conditions that could be associated with them. From your arms and legs to your palms and back, each itchy spot can offer important clues about your overall health. And while the majority of itching might be caused by something relatively harmless, such as dry skin or a mild allergy, it's still essential to keep track of any changes in your body, especially as you age. It's not just about alleviating the discomfort. It's about paying attention to the signals your body is giving you and responding accordingly. So, let's quickly review some of the key takeaways. First, remember that itchy arms, particularly the upper arms, could be linked to conditions like eczema, liver disease, or even environmental allergies. If you've been experiencing these symptoms consistently, it's worth having them checked out by a professional. Similarly, itchy feet can be caused by fungal infections like athlete's foot or even nerve issues like peripheral neuropathy. Don't ignore the itch. Treating it early can save you from complications later on. Next, your hands are another area that deserves attention. Itchy palms, especially if they're accompanied by redness or swelling, could signal an allergic reaction or even liver disease. And don't forget about your back. While it might be tough to reach and examine, persistent itching on your back should not be ignored. Conditions like shingles or kidney disease can present themselves through localized or widespread itching, and early detection is critical. At the end of the day, itchy skin is your body's way of communicating with you. Whether it's telling you that you've been exposed to something irritating or that there's a deeper issue at play, your body deserves your attention. And as we age, the importance of keeping up with regular checkups and staying on top of any health changes becomes even more vital. If any of the itchy spots we discussed today sound familiar, don't hesitate to make an appointment with your doctor. A quick visit could put your mind at ease and help ensure that you stay healthy and comfortable. Now, I know it can sometimes be difficult to keep track of all the little things that change as we get older. It might feel like every new symptom or it's just something to worry about, but that's not always the case. However, it's essential to listen to your body and take action when needed. As a senior, your health is your greatest asset, and maintaining it requires a little extra care and attention. The good news is that most of the conditions we discuss today are treatable when caught early. So, don't wait until the symptoms get worse or until it feels like too much to handle. Get to the doctor, ask the right questions, and take charge of your health. As you move forward, keep an eye out for any changes in your skin. And if something doesn't feel right, trust your instincts. And while we're at it, take care of the basics. Keep your skin moisturized, stay hydrated, wear sunscreen, and pay attention to any products or habits that might be irritating your skin. It's all part of taking care of yourself and maintaining a high quality of life. Before we end today's video, I want to leave you with this. Itchy spots are not something to ignore, especially after the age of 60. These little annoyances can sometimes be a sign of something more significant, and being proactive can help ensure that you remain healthy and comfortable. If you've been dealing with any of these symptoms, make sure to see a doctor for a proper evaluation. Your health matters, and taking small steps now can help you feel better and live a longer, happier life. If you found this video helpful, I'd love to hear your thoughts in the comments below. Have you experienced any of these itchy spots, or have you found solutions that work for you? Please share your experiences with others in the community. Also, don't forget to like this video and subscribe to the channel for more helpful content on maintaining your health and wellness as you age. Together, we can make sure that we continue living our best lives, no matter what age we are. Take care of yourselves, stay healthy, and I'll see you in the next video. Remember, you deserve to feel comfortable in your own skin, and you have the power to take control of your health.